usually we see certain women that after delivery, they say, "Getting koyoka, which is EPIS. If a woman is going through delivery and the delivery is prolonged, to save the child, usually they will perform episiotomy on the woman. In a case where episiotomy is not performed on the woman can just tear on her own. And in this case, the female genitalia, the genitalia is very close to the anus. That means if the woman has to tear on her own, it can tear from any side, and it's very difficult to manage. That is why usually in the hospital, if the midwife realizes that prolonged labor is happening and the woman is not dilated to 10 centimeters, they have to tear so that it can be easily managed. And after this tear is done, the woman is usually sewn again. There was this time at Serekunda Health Center where a woman was teared, and after delivery, because of the pain, she was too scared for them to sew her again. And you know what is going to happen? Usually when they go back home, they start, you cannot control the faces, you cannot control the urine that is coming up. That is where stigma in society comes in. Because now anywhere that you go and sit, anywhere you stand up, everywhere is wet and it starts smelling. That is why fistula is very common. And fistula in the government hospitals, they cannot treat it. Currently, it's Dr. Jad that usually treats fistula, and usually $24,000, that is what women usually spend to treat fistula. Aside from fistula, just last week I was in Basse. I was with my colleague and she showed me a picture and said, "What is this?" It was a woman that delivered in Lamtoro Hospital. She had a relapse. A relapse, it's a medical term, but it's usually when a woman delivers, sometimes you have the bladder that comes out of the woman's vagina. I saw the picture and I was like, I know what this is. I forgot what the name was, but I think it's like a protruded bladder, like a bladder that came out. I told her, where did this woman deliver? The woman delivered a week ago. Definitely, they already did the naming ceremony, but she was still sitting at home with that pain and did not tell anyone. I think the pain became more uncomfortable, and she took the picture and sent it to her friend. That friend sent it to my colleague at work. I told my colleague, this woman should be rushed to the hospital. Because you know what is going to happen? If anything has to happen to that bladder is like a plastic bag. If it tears or if it bursts, that medical surgery does not happen in the Gambia. Usually they have Cuban doctors that usually come here to perform such surgery. And in a case where that surgery is performed, it can still tear again. Because you know what is going to happen to a plastic bag? You tear a plastic bag, if you sew it, it can still burst out again. So these are some of the complications that are driving this force. And what I am saying is, one size does not fit all. Out of 100 women that were circumcised, even if one person says, I went through this complication, if it's a stoppable practice, then we need to stop it, because you never know whose child is going to be subjected to that practice. FGM type 1, which is just the removal of the clitoris. You're saying, okay, now, we say it has been happening during the Prophet's time, but we all know it used to happen to children that were 5, 7. Now they take babies. A baby's vagina has not even grown. The organs, the clitoris has not grown. The labia has not grown. And you're saying you're taking this baby to a Ngansimba to go and cut a little in that clitoris. The clitoris is already little. How would you cut little? Because now if you cut little, you're cutting everything from the clitoris. It means nothing is going to be there. That is type 1. And when it comes to type 1, it has complications, but maybe the complications are not as much as the complications that the woman is going to face with type 2. Because with type 2, they will remove the clitoris and remove the labia. The labia is an organ in the female genitalia, and it usually stretches when a woman is going through delivery. If you don't have anything that is stretching, that is going to help you remove the baby, that is where complications are going to come from. So usually it's very disheartening. Usually we associate delivery with pain. And some people will say, it's God that helps. Yes, it's God that helps. But if there are factors that are also associated to why a woman is facing complications during delivery, and these factors are something that we can do without, then why are we still adamant that we should not do without it? It's very disheartening to see men to stand and say, let's continue this practice. Because those men usually will not sit with their siblings, female siblings, to say, you went through FGM, are you going through anything sexually? You went through FGM, what happened during labor? The reason why family plan, the Jamie Foundation has this system where men have to be in the labor room is because they want men to see the complication that most of their women are facing during labor. I worked in a hospital. I worked at Serekunda Hospital, Serekunda Health Center. I worked with Brikama Health Center. These are not things that I'm saying, it's not hearsay. I went through FGM. It might be type 1, but I might not face any complications right now, so I can say, oh, there are no complications. But the reason why I'm saying this is because I'm not reading from this, but these are things that I've seen in hospitals. And I know the reason why I left the healthcare profit, because it was mentally draining. You see some of these complications are there. The Gambian hospital do not have facilities that are going to help these women. So what are we going to do? Are we trying to increase another burden on what is already happening in our hospitals? We're talking about religious perspectives. Religion does not force anyone to do this. You do it, you get reward. You don't do it, you don't get reward. So why are we still adamant on it? No one can come and stand and say the Prophet has subjected this to the children or the wives. Going back to history, the issue of female genital mutilation or female circumcision, usually it's performed on certain kinds of people. Those are people, and it's usually done as a form of treatment. We have certain people that have outgrown clitoris. It does not mean that everyone has an outgrown clitoris. Even in other words, we still have women that feel like their clitoris have grown, overgrown. They go and perform surgery, but it's with consent. It does not mean that every child that is circumcised in the Gambia is going to have an overgrown clitoris. So that means we are treating people that are not sick. We need to know history. We need to know where these issues come from. It was used as a treatment, and it was something that was a cultural treatment, and that is why it was said that when you're removing just a little. If it was something that has to do with cleanliness, or it was something that has to do with reward, the Prophet also wanted reward. The Prophet would have wanted his children and his wife to also be clean and to also have the reward. He would have done it, but it was a treatment. And he knows his children were not sick, his wives were not sick, so he did not perform it on them. We still have people in Saudi who usually, even after they give birth, they still go back to the hospital and say they want to be stitched. It's consent, it's choice. So let's not say, oh, even the West, they remove their clitoris. They want it, but now we're doing it to babies. Babies grow up and feel like, oh, this particular thing has been removed from me and I did not consent to it. Why should we? It cannot be a matter of choice because it's not adults that are doing it. So this is the medical perspective, and this is what happens with fistula, and that is what keloid as well is. The government facility is not well equipped, and we do not have the capacity to manage complications of FGM, and that is why, as a National Assembly, we have better things to fix, and that is the health care before we start saying that we're going to make sure this law is now.